My mother was a nurse and my older sister was a nurse, and my favorite subject in high school was biology. I started working at our local hospital in my hometown in Iowa at age 16 as an orderly. Later I had jobs as an ambulance attendant, as an EMT, and then during my summers during college I worked as an operating room technician. In the sports medicine we do a lot of knee reconstructions, knee scopes, and then also a great number of shoulder procedures. With our elderly population here in town, all of us do a lot of knee and hip replacements. Great deal of experience, and the nice thing is you're always learning something every day, and every case is still a new case. So that process never gets old, and improving and getting better no matter how many years and how many cases you've done. As a surgeon, oftentimes people think that's all we do is just do surgery, but for all the people we see, it's probably only a small percentage, maybe 10 or 15% that need surgery. And a lot of people have problems that may need surgery sometime in the future or really aren't surgical at all. And we help the family practitioners evaluate the problems and get people on the right path. And so conservative measures are always very important. And if we can get somebody well without an operation, that's always the best choice. My father was a teacher, and one of the things that I do in clinic is do a lot of teaching, kind of in that heritage. And so many times if people understand their problem and the anatomy and the physiology that goes with it, the different non-surgical things we recommend, whether it's physical therapy or medications or what have you, they understand the purpose and the function of that, and they can do a lot better job getting well kind of in the natural way. The more years you do this, that's really kind of the fun part, because in Bellingham and this part of the country, we have a lot of great people live up here, but it's those interactions with the people that really makes it worthwhile, because the hours are long and there's a lot of sacrifices, and our families share in those sacrifices. We're away from home maybe more than we would like, but it's very gratifying when you can help people in a real dramatic way, and that's one of the reasons why orthopedics is such a sought-after profession. So the other part of it's when patients come back to clinic and you've got them all fixed up and well, and you can kind of hear the gratitude in their voice. That's what keeps us going, and it makes it a special job. In any medical school class, usually it's just the top kids can get into orthopedic program, and it's because it's so fun to do that everybody wants to do it, and so I was fortunate enough to make that my path, and it's been working out just fine.